presenting on mercury poisoning, more to highlight that mercury is in our environment, mercury is in our homes, mercury can present in with our patients. So this highlighting is simply to make us more alert onto the possibilities of our patients presenting with irritability, or patient presenting with abdominal pains, or patient presenting with nephritic renal issues. Is it possible? So that even when you're taking the family and social history, the time we used to take very detailed family and social histories when we were doing undergraduates. But thereafter, we've tended to be more specific, more quick, much quicker in taking our history, and the family and social history, community history hasn't been that detailed. So this is one of the things which will make us start looking at things in a different perspective. There used to be an English saying, as mad as a hatter. And it is in the 1850s when hats were a major donning item, a major beauty item. And the felts were made from mercury. And it was noted that those who worked in the industry, in the hat making industry, were almost neurotic, and hence the reason as mad as a hatter. So that tells you that, but just with observation, then it's possible to pick out many of these things, because it's unlikely many of those people working in those industries had mercury levels being done, but just the association that they're working in that industry, and they're all large number of them were quite neurotic, then this was quite apt. Just to highlight, I'm presenting a 5-year-old male. The current weight had current weight at that point in time of 15.5 kilos. Temperature at that point of admission was 36.6. His oxygen saturation was at 97%. We had him in the ward for about 24 hours observation. He was brought in because mom had noted that he had severe cramping abdominal pains. Mom had left the young man in the room playing, and there was a thermometer in the room. By the time she came back, she found that the thermometer had been broken, and there was mercury spilled on the surface, and the child at that point in time was irritable. And subsequently, that was in the evening, mom tried to clean up the room, didn't use a vacuum cleaner, but tried sweeping out the mercury, but then the mercury bubbles kept on rolling all over the place, and she did what she could. And the following day, she took the child to hospital, and they were started on laxatives. But the child wasn't getting any better, hence the reason for us to see. In the background is that the child is on follow-up for autistic spectrum range. So then this irritability, the crying, is it purely because of the thermometer, or is it because of his autistic spectrum range, for which many a times because of their presentation, then sometimes difficult to pick out. But mom was quite keen, and with that she was able to bring the child to hospital, say it's not getting any better. And we have a look at it. On examination, he was quite irritable. He was febrile. Because of that cramping pain, reduced oral intake, had some dehydration. There was a bit of running nose. So this irritability, is this cramping pains, is it part of a viral infection, or is it something else? Per abdomen, nothing significant. The abdomen was halfway. It was no tenderness, no organomegaly. Blood results, the renal function was essentially normal, with a REA 2.07, sodium and potassium within normal ranges, the blood counts all within normal ranges, with a hemoglobin of 11.9, with an MCV of 76.6, so respected with autistic spectrum, with a selectivity in food for you to have an iron deficiency anemia, but for this one was doing quite well. C-reactive protein was elevated at 26.7. Urinalysis was normal. The significant findings were in serum mercury, where it was almost 10 times the upper limit. Serum mercury for the patient was 9.22 micrograms per liter. The upper limit was 1.3. We did abdominal X-ray and we could see radiopaque particles scattered in the colon. This was within 48 hours later on. And we put on penicillamine, while the irritability, the raised mercury levels in serum, the scattered radiopaque entity particles which were seen on abdominal X-ray, with hindsight that in history, the child had been playing with a mercury thermometer, and what was found was a broken thermometer when the mom came back into the room with minimal spillage in the room. We put on IV fluids because with the irritability, with the reduced oral intake, with the some dehydration, hence the reason for rehydration, we put the child on laxatives to try and see if we're able to reduce contact in the gut, to reduce absorption of the mercury into the body system. And the child did well, went home on the penicillamine and on follow-up did well. And 1 year down the line, we haven't had any worsening of his autistic spectrum range presentations. So then mercury is a naturally occurring metal. It's quite common in our environment. It exists either as metallic mercury or it's on inorganic mercury compounds, which mainly appears in powders or crystals, and also as organic mercury compounds. The vapors from mercury, metallic mercury, are more potent than other forms. That becomes important during disposal, where when you really think about how do you dispose of mercury entity component levels of exposure, hence the reason for having put the patient on penicillamine and also having gone to the next level of having to put the child on laxatives to try and reduce the amount it is going to last in the body for a longer period than should have been necessary. So that the bigger thing is awareness and preparedness to how to handle outcomes of mercury exposure. But even before understanding the exposure, it's to understand that where is the mercury, because there are no safe levels of exposure. How much is it will cause damage to my body system will be totally different from somebody else. So that there's no good level, there's no low levels, there's no high adequate levels. Exposure is exposure, and the possibility of toxicity will always be there. The biggest challenge is ingestion of mercury. Then there's also breathing from contaminated air. Then ingestion, so there's contact on the skin. There's ingestion from contaminated water and food. And then also from breathing in contaminated air. There's huge discussions about how much mercury is in certain food components. So then you're finding that even in the fish from the seas, then this type of fish has a higher mercury component depending on the food chain or where it is. So they'll also have a higher mercury level, so that there'll be advice. Breastfeeding mothers, pregnant women should not be able to consume certain types of fish because of the concern about the amount of mercury in the fish from certain area jurisdiction. We look at a few examples where mercury is present and innocently. So of late, we've moved more from to the bottom to the disk batteries for the energy electronics in our homesteads. Your mobile phone, your remote in their house. Many gadgets in the house, the toys for kids, many of them will be having these button batteries. And the big challenge is not that they're able to leak the mercury. Actually, the biggest concern for the gastroenterologists in terms of the button batteries is the ingestion, because when they get ingested, then they cause burns. We have a child who swallowed this button battery and had perforation in the esophagus, was repaired about 3 weeks ago, for which we are still following up. So the biggest concern in the GAT group is more of the burns rather than the mercury. The mercury in this, worry about mercury is in terms of disposal. How do we dispose of our button batteries, our button cell batteries? We will throw them away, they'll be collected. Generally, we tend to burn stuff, and when it's being burned, then the mercury, the little mercury available in this button batteries, and then it's going to be released into the air, get contaminated air with mercury, becomes easier to ingest. So where is it going to be incinerated? The other thing, we collect all our garbage and throw it out and dump it in the landfills in different areas in the city. Then is there seepage of all that component as this breaks down into the land and it seeps into the soil? Does it get into the groundwater? Does it get redistributed onto the population? There's a huge discussion about safety of amalgam. Amalgam had a good component of it on mercury. The safety concerns were allayed, and amalgam is still quite prominently used for dental fillings. But the bigger issue is not even the exposure while the amalgam is in the mouth, but it's more at point of disposal. There was a big discussion about 2-3 years ago in Kenya about creams, Rangia Thao, where skin lightening creams containing high mercury levels for those who want to change their skin color from dark to lighter, because it is perceived, certain perceptions that the lighter the skin, the more beautiful somebody is. So then this is a long list, quite a busy slide, a long list of creams which were banned by Kenya Bureau of Standards a few years ago. And the pointer to this is that it is important to know what creams are we buying for our families. When I'm prescribing creams, do I really know other ingredients which can be in that? Because I'm not part of the importing entities, but it is important for each one of us to know for the grooming, what cream am I buying for my family? What cream am I buying for my wife? What cream am I buying for my children? And what do they have in it? Do they have any of these elements like mercury, which will cause more trouble later on onto them? Because even in part of the whole list, I can see this Morvet cream, which most likely is a steroid cream, might be used for other things, but it's important to know that the creams which we prescribe innocently or intentionally for one reason or the other might be very important to know other ingredients, so that the more familiar you are with your product, then the less chances of you getting into trouble with the certain components. This is the culprit for our patient, and this thermometer is what we grew up with. This, you put it in your axilla, in your armpit, or you put it under your tongue. If your temperature is high, the mercury there gets heated up, and it rises from there to give you your body temperature. But this is a glass filled, this is a glass made thermometer. It's very easy to break, and if it breaks, and then the mercury gets to spill over, and that tends to expose. Then these thermometers were available, but we never at any point in time thought of how to, in case of an accident, because in case it breaks down, we never thought of what will we do with the mercury inside there. And obviously for the young one and it broke, I'll be playing around with the mercury because it's something which You can chase it around the whole day. You try to pick it and you can't really pick it up. And it will have been a very nice play, because then the cartoons were not that prominent. This will have made a very nice thing to play with. So there are many gadgets in the homestead available. It will be important for us to, even as you're having all these gadgets, what do they contain inside? In case of an accident, in case this breaks, how do I deal with that? We are very happy when we have gadgets, but when they break down, it will be important to start looking at it. How do I sort out the messes associated with it? So the awareness of the Mad Hatter, the awareness that the observation of the mercury poisoning, the observation of the behavior of the people working in the art industry. Is it something which we can use in our practice in our home, so that you say, am I able to take history and even include all these contaminants in the environment as part and parcel of my history taking, so that when you really think about it, then the family and social history, the home surroundings, and a graduate used to say, even at how many taps are in the house, how many windows. But with time, it sounds like it's a big joke, but I think it's important we go back into the detailing history to try and figure out exposure, so that not all the pathology is due to microorganisms. There's a significant pathology coming in from the environment. So if an environment is contaminated, then it's possible, and then that is part and parcel of the patients presenting with different pathologies. Thank you.